All right, so this is the alternate electronic visit verification informational webinar. Testing 1, 2, 3. Testing 1, 2, 3. This is the sound test just to ensure everyone can hear. So we are testing the sound at this time. Anybody who may need to adjust their sound or volume has an opportunity to do that at this moment. For our webinar questions today, all attendees will be put on mute. So if you have a question, you can select the chat icon or option in the toolbar and type your question in the box provided on the bottom right-hand side of the screen. Your instructor and the EVV team will answer as many questions as possible during the time allotted at the end of the webinar. For easier viewing for today's webinar, you may click the Enter Full Screen button in the webinar window to make the presentation larger on your screen. To get back to the window where the chat box displays, hover over the top middle of your screen to see the webinar bar, click View Options, and then click Exit Full Screen. Today we're going to cover what is an alternate EVV system and who is eligible for it, important information and resources, what is the process to certify an alt EVV system, new certification versus recertification, and frequently asked questions about alt EVV systems. We're going to start with what is an alt EVV system. The Ohio Department of Medicaid provides an EVV system free of charge through Sandata Technologies. An alt EVV system is a different or alternate system other than Sandata's EVV system that is used to capture the required information for the ODM EVV program. Only agency providers may choose to use an alt EVV system to capture the required EVV data. Now we're going to cover alt EVV important information and resources. The greatest resource for information is the Ohio Department of Medicaid's EVV Initiatives webpage. A portion of the site is specifically dedicated to alternate EVV systems and information that agency providers need to know regarding them. This portion of the site answers the questions of what do I need to know for an alt EVV system? When looking at the information contained within the Alternate Systems tab, it's key to know that all alt EVV documentation on this page is important. Agency providers who are considering an alt EVV system or who are in the process of setting one up should be careful to read all the information and documentation on this page. It's especially important to note the documents that are listed underneath each phase on the Alternate System tab. These documents outline the specifications that alt EVV systems must adhere to. Two key documents to note are the business requirements and technical specifications. The business requirements document contains an outline from ODM on what alt EVV systems must be able to do in order to comply with the ODM program. The technical specifications go deeper into the specific setup of data that would come into ODM from an alternate EVV system. Please note, these documents are not intended to be a guide on how to build an alt EVV system. However, they do list the requirements that must be met in order to certify an alt EVV system. All the requirements in both documents must be met. From these two documents, there are a few requirements that are especially important to note. ODM and Sandata are not responsible for any costs related to setting up an interface with or implementing an alt EVV system. Agencies must be the ones to initiate the alt EVV setup process, request testing credentials, and request production credentials. An alt EVV system must complete the setup and certification process for each agency's Medicaid provider ID with whom they contract. How often an alt EVV system sends data to the Sandata aggregator is up to the alt EVV system, but it must be within 24 hours of data collection and/or any edits made to the data. Voice and/or digital signatures must be obtained and stored in the alt EVV system. And indication that verification was captured or not captured must be sent to the Sandata aggregator. In addition, there are a couple requirements that must have been in place by January 1st of 2019. The first requirement is that alt EVV systems must use mobile GPS technology to collect GPS coordinates in real time at the start and end of the visit as the primary method of data collection. The second requirement is that alt EVV systems must offer at least 2 backup methods of visit capture, and manual entry must be one of those methods. There are additional documents listed on the Alternate System tab to be read and to become familiar with. They are the exception code listing, reason code listing, and required data elements documents. These documents are referenced in the technical specifications and business requirements, so it's important to read them and ensure an alternate system is complying with them as well. A quick note about the exception and reason code information. The Sandata aggregator is a read-only view of the alternate EVV data that is sent to Sandata. Providers cannot resolve exceptions and add reason codes for missing information on visits in the Sandata aggregator. Alternate EVV systems must provide a way to resolve exceptions, edit visits, and manually enter new visits. For example, in the top screenshot, you see a snapshot of what the visit review grid in the Sandata aggregator looks like. Notice that there are red dots on the visit line, indicating that there are exceptions for missing information for this visit. When the visit is clicked, you would see the visit detail screen, which is the bottom screenshot on this slide. The client verification indicators are noting that client verification of time and service for the visit was not captured, and neither was a client signature. As you can see from the exceptions tab of the visit, and we're calling out the exceptions themselves in the top screenshot, and the verification missing in the visit detail screen in the bottom screenshot. And now, as you can see from the exceptions tab of the visit, there was also a missing call out for the visit. All of these exceptions are visible in the Sandata aggregator because it will recognize when there are missing data elements on the visit. However, the Sandata aggregator is a read-only portal. No changes can be made to the visit data in the portal. And this is why it's important for an alt EVV system to be able to display exceptions to providers and to provide a way to address them before the data is sent to the aggregator. The table on your screen is the exception code listing that currently exists for phase 2 of the EVV program. If you were to click on the exception code listing link on the ODM alternate system tab, this is what you would see. So this is an important table for alt EVV systems to be aware of. And this is the current listing of phase 2 reason codes. So whenever an exception is resolved in a system, a reason must be listed for why that exception occurred. And this is the list of acceptable reason codes as of phase 2. Additional key information included on this page is under a section called Resources. Here you'll find a link to take the Alternate System Aggregator training. All alt-EVV providers must take training on the Sandata Aggregator, because this is where providers who are using an alt-EVV system will be able to see their visits as ODM is seeing them. This training is a self-paced online training that trains providers how to log in and use the Sandata Aggregator. But please note that it does not set you up to use an alt-EVV system. Taking training is one step in the process to certify and set up an alt-EVV system. Speaking of the alt-EVV system certification process, this can also be found under Resources on the ODM webpage. All providers who want to use an alt-EVV system must have their intended alt-EVV system certified or approved by ODM with Sandata's help. It is up to the provider to start and drive the certification process. So what is the process to certify an alt-EVV system? This is an overview of the updated alternate EVV certification process in its entirety. All of these steps must be completed in order for an alt-EVV system and provider to be certified. We're going to break each of these steps down now, starting with step 1. The provider makes a request to start the alternate EVV certification process. The provider would start the process by reaching out to support or the EVV provider hotline to request to start the process. And we recommend a written request by email, or you may also call the EVV provider hotline. The provider would then be contacted back by support to confirm their request. Once support initiates the alt-EVV setup in eTRAC for the provider, it will open up an alternate EVV request tab for the provider to see in eTRAC. So this is where you can see the back and forth communication with support regarding your alternate EVV certification. Now, to send a request in writing to support, you would send an encrypted email to connectmyeVV@etraconline.net, and that email will be displayed again at the end of the webinar with a list of resources to contact. When that email is sent, you want to be sure to include your name, your provider Medicaid ID, your phone number, and the alternate EVV system that you intend to use. Once the alternate EVV request tab is opened up for you in eTRAC, you will be able to see the technical specifications and business requirements documents, as well as exception code listing, reason code listing, and required data elements also on that tab. I believe those links are directly back to the ODM website. There is a note that you should take here that you will still want to check ODM's alternate system tab on the ODM website periodically, because it does have updates that are provided there every so often from ODM regarding alternate EVV certification. Step 2, the provider retrieves alternate EVV system information, and you can do this either from eTRAC or the ODM webpage. Notice that you can access both Phase 1 and or Phase 2 alternate EVV documents, and you see a screenshot on this slide through ODM's webpage. For any provider who is looking to start the alt-EVV process, you would want to focus on Phase 2 certification, and there'll be more information on that in just a moment. But the screenshot currently has Phase 1 and Phase 2 documentation, because that is what you would see on ODM's website today. You would just want to know to pay attention to the Phase 2 documentation, because Phase 1 certification will officially close on April 18th, 2019. Step 3 of the process, the provider works with your system, your alt EVV system, to review all necessary documentation. So if you or your system, your alt EVV system, have any questions regarding the documentation, you would work with the EVV provider hotline to relay your questions, and they will take appropriate steps to provide answers. Please just be as specific as you can when relaying questions back to the EVV provider hotline. And just as a quick review, the 5 required documents are listed on this slide. They are the business requirements, technical specifications, reason code listing, exception code listing, and required data elements. Step 4, the provider would take alternate EVV training on the Sandata aggregator. And this is typically done while the alt EVV system is working on building to specifications. The provider is responsible for taking training on the Sandata aggregator, and you would do this through the Learning Management System LMS. There's a link to the Sandata aggregator training on this slide, but you may also find it under the Training tab of ODM's website, or under the Resources tab that was previously mentioned. The training itself is self-paced. It does not take long. It's about 30 minutes. And the Sandata aggregator is used in the EVV claims adjudication with NIST. So it is important that providers know how to use it and how to log in and validate their data in the aggregator. The training must be taken, and the training certificate must be presented to the EVV provider hotline before testing credentials can be released. And that is the next step in the process, step 5. When your alternate EVV system is ready and the aggregator training has been completed, the provider may request testing credentials from the EVV provider hotline. For quality assurance, Sandata tests all credentials before they are sent to providers and their systems to be used. The testing credentials will be provided directly through the eTRAC portal for security reasons, and a notification will be sent both by email message that there is a message in eTRAC. It is your credentials so that you know to log in and pick those up. But you will also receive a phone call from the EVV provider help desk notifying you when testing credentials are available. Step 6 of the process, the provider works with Sandata to conduct testing. A vendor must conduct testing for every agency who wants to use an alternate EVV. So in other words, that's each individual Medicaid provider ID. While a vendor may lead testing and work directly with Sandata, they must copy their provider on all communication. The provider should still be driving their alternate EVV certification or recertification. The provider or vendor must notify Sandata when test files have been sent. So once you reach the testing phase, the EVV provider hotline is going to provide a testing process document that will walk you step by step through the testing process, which includes the information of where to send your testing and documentation, your test files rather. Sandata does not get a notification when you have uploaded test files, which is why you must notify Sandata when those test files have been sent. And when you do that notification, you must indicate the file IDs, otherwise known as the UUIDs of the test file itself, so that Sandata can easily locate and review that file for you and do that in a timely manner. The EVV provider hotline will follow up with you if you do not notify Sandata of available test files within 14 days of credentials being issued. And this is just a courtesy to let you know that your credentials were available in case you missed the communication and that you may continue with testing. So we will monitor that and follow up to see, make sure you're aware your credentials are available and see if there are any issues. Once you have notified Sandata that there are test files to validate, Sandata will validate them. If there are errors in testing, the provider must work with Sandata and or their vendor to resolve. Sometimes it's a team effort in getting those errors resolved. Sometimes they may originate on the vendor side. It's all parties working together to figure out what's going on and get it resolved. And the provider vendor must send the completed training checklist back to Sandata before production credentials can be requested. So there is a screenshot of what that testing checklist looks like in the upper left-hand corner as it relates to the Ohio Alternate EVV Interface Testing Process document. And that's the document that's provided from the EVV provider hotline that walks you through the testing process. But for ease of submission, there's also an electronic file that is provided, an electronic version of that checklist. So if a provider or vendor just wanted to copy the UUID and paste it into the Excel document, it makes it a little bit easier to do that and submit the checklist back. Now, this testing checklist is a listing of all of the testing scenarios that are outlined in the testing process document. It used to be that they were suggested tests, but now every test on the checklist must be completed. So it must have a UUID submitted for it in order for the certification process to move forward. And this is just to make sure that every scenario that could occur with the data has been tested and validated, worked through, so that it doesn't become an issue for you later. Step 7, the provider identifies your go-live date and requests production credentials. In order to ensure that providers have the opportunity to prepare staff and be ready for their alt EVV system go live, they must choose a go live date and notify Sandata of it in writing. Production credentials will not be issued until this occurs. As a reminder for quality assurance, Sandata tests all credentials before they are sent to providers and their systems to use. Production credentials will be provided directly through the eTRAC portal for security, just like the testing credentials were. And along with the production credentials, Sandata will generate a welcome kit with login information for the Sandata aggregator. You will be notified by the EVV provider help desk via phone and eTRAC message when the production credentials are available. You would log into your eTRAC account to retrieve both the production credentials and the welcome kit. A quick note of something that's listed on your slide, and one reason why the go live date is requested. If you have already been using Sandata at the time that you go live with your alt EVV system, any TVV or telephony or telephonic visit verification phone lines that are in use, or MVV, mobile visit verification accounts that exist for employees, will be disabled. So that would essentially stop the use of the Sandata system and be a clear indication to staff that they should be using the alt EVV system. So that's another reason why go live is requested in writing, just so everybody's on the same page with when that will be occurring. Step 8 of the process, the provider confirms live data is in the Sandata aggregator. Once the provider receives production credentials and puts them in place, as of the selected go-live date, they may start seeing visit data in the Sandata aggregator. Remember, how often an alt EVV system sends data to the Sandata aggregator is up to that alt EVV system, but it must be at least once a day or every 24 hours. Keeping this information in mind, you'll want to use the login information from your welcome kit to log into the Sandata aggregator and check for visits that have been made in your alt EVV system. If you do not see live visits in the Sandata aggregator that have been made in your alt EVV system in an appropriate time frame, reach out to your alt EVV system to start the troubleshooting process. If need be, your vendor may reach out to the EVV provider hotline for help if there's still an issue after they check the sending of data on their end. Step 9, and this is the final step. Once live visits are confirmed to be received by the Sandata aggregator, Sandata will notify ODM of the provider and the system or the vendor's certification, if the vendor has not already been certified. If the alt EVV system is not already listed on ODM's website as a certified alt EVV system, it will be added to the website list. Keep in mind, the alt EVV system would still need to go through the certification process with each agency provider who chooses to use their alt EVV system. Now that we have reviewed the alt EVV certification process for providers who are certifying their alt EVV system for the first time, we'll review what will need to happen in phase 2 for providers who are already using a certified alt EVV system. There are some changes for phase 2 to how the EVV system works and what it should include. New requirements for using EVV in phase 2 include an expanded list of payers and, of course, an expanded list of service codes that go with each payer, the ability to log group visits, new service codes, updated exception codes, updated reason codes, alternate identifiers for the Ohio Department of Aging, for instance, managed care organizations, there's an alternate ID that can be entered for clients. Retroactively applied Medicaid IDs are part of phase 2, and visit exceptions can now be configured by payer. Because of all of these changes, what this means to phase 1 providers is that if they have already been certified to use an alt EVV system in phase 1, they would need to recertify to use an alt EVV system in phase 2, just to ensure that they are still able to comply with those phase 2 specifications. Phase 2 providers who wish to use an alternate EVV system for the first time in phase 2 must set up their alt EVV system according to the phase 2 specifications, and they must go through the certification process. Now, the phase 1 recertification process is the same as the certification process that we just went through and reviewed. It would just be a certification process for phase 2 now instead of the phase 1 certification they have already obtained. The phase 2 specifications were posted to the ODM website on September 28, 2018, so they have been out there for a little while. So both phase 2 alt EVV certification and recertification are currently open and in process. If you wish to begin the phase 2 certification or recertification process for the first time, here is that email address that we mentioned earlier. You may contact connectmyevv@etraconline.net. Here's a listing of that information that you would want to include and ensure it's in an encrypted email. The name of the person making the request, provider name, provider Medicaid ID, the best email or phone number to be reached, and the alt EVV system name that you intend to use. A quick note about eTRAC, however, and you'll notice that the address includes etraconline.net, which means you would be sending this message to the EVV provider hotline through eTRAC. If you have not already registered for an eTRAC account, or you cannot register, you must call the EVV provider hotline at 855-805-3505 to initiate your alternate EVV certification process. And here's a little bit deeper explanation as to why that might be. You may still send emails to the EVV provider help desk at the account that was just listed. However, if your email address cannot be matched with an existing eTRAC account, you'll receive a generic bounce back from that address that's asking you to call the EVV provider help desk for assistance because your email could not be matched up or recognized. So to avoid this, you want to ensure that you have registered in eTRAC using the email address that you expect to use for communication throughout this process. The EVV provider help desk will respond to all written communication through the eTRAC messaging system. That's the only way that they can communicate with providers, which is a reason why eTRAC is so important and registering in eTRAC is so important. When you have a message from the EVV provider help desk in eTRAC, you will be notified via the email address that you registered in eTRAC with a message like this screenshot on this slide. So it will let you know when you have a message existing for you in eTRAC, so you don't have to log into eTRAC all of the time. It just won't be able to display that message to you in your email. You would log into eTRAC to pick that message up. Now here is a visual representation of the certification and recertification timeline for Alt EVV. So we have the January 1st, 2019 date that's indicating when mobile GPS technology must be the primary method of collection in all Alt EVV systems. It also notes that that's the date that at least 2 alternate methods of visit entry must be offered, in addition to mobile entry, by all Alt EVV providers or vendors. And one of those methods must be manual entry. The next key date coming up is April 18th. This is when Phase 1 certification is officially going to close, and only Phase 2 certification or recertification would be open and available from that point forward. So if you are anywhere in the Phase 1 certification process at this time, just know that April 18th or next Thursday is the cutoff for that. So if you have any concerns about finishing your Phase 1 certification, it could be good to start having a conversation with your vendor about Phase 2 certification. Please note that you do not have to complete your Phase 1 certification to just skip ahead and work on your Phase 2 certification. So you don't have to do one to do the other. So if you are somewhere in the process, you could just stop Phase 1 right now and start working on Phase 2. And then the last date here is May 6th, 2019. This is when alternate EVV recertification of Phase 1 providers, or in other words, certification for Phase 2, must be complete, or in other words, is strongly encouraged to be complete, because May 6th, 2019 is when the Phase 2 system changes for EVV go into effect. Now, our note here says that provider data cannot be accepted. If you have any concerns about having your Phase 2 recertification completed by May 6th, please just know that you can reach out to ODM to work on that with them. But because the Phase 2 system changes go into effect on this date, everybody is encouraged to work to recertify by that date as much as possible. Okay, who do you contact if you have any questions or issues? The top bullet point here is who you may reach out to if you want to express interest in using an alternate EVV system. It's the connectmyeVV@etraconline.net address. If you have any questions or issues about the EVV certification process, you may reach out to the EVV provider hotline at the number listed, or EVV provider help desk at etraconline.net. And this is mainly to ask questions or work through concerns. All right, when you do reach out to the EVV provider hotline, please just be sure to put in your email or mention on the phone that you're calling about alternate EVV. And it's helpful to mention that first when you reach out, because they may have another resource to direct you to, especially if you have questions on the specification document. And finally, you can contact the EVV team at ODM through evv@medicaid.ohio.gov if you have any questions or issues that you don't feel have been addressed by the EVV provider hotline, or if you have questions regarding the policy of alternate EVV systems. All right, at this time, please feel free to locate the chat box on your screen if you have any questions. We're going to read through some of these and then we'll answer them live on the line. One question that we had come in here is, if a provider agency chooses to use an alt EVV system, will all direct service providers need to take the Sandata training or just admins? You are only required to have at least one person from your agency for your Medicaid ID take the training. It's typically administrative staff who would need it, but as long as one person does, you have met the requirement. Another question here, am I understanding correctly that after April 18th, 2019, Phase 1 providers can no longer choose an alternate vendor because the certification period is no longer open? I'm going to answer that question first, and then I'll answer the second part of this. No, Phase 1 providers may still choose to go the alternate EVV system route and to have an alternate vendor certify. It's just after April 18th, 2019, you would only be using the Phase 2 specifications to do your certification. Now, the second part of this question is, will there be an end date when Phase 2 certification is closed? There's no official end date. However, the mandatory use date for Phase 2 is August 5th, 2019. So it's encouraged that if you are working on certification, to have everything up and running by then so that you can make sure your data is showing up as you would expect it to in the Sandata Aggregator for ODM. But you can choose to use an alternate EVV system at any time. Another question that came in here, most of the information says and or voice recording, and that's in regards to specifications for the alt EVV system to provide verification options. And there is confusion out there where EMR vendors believe they do not need voice recording. So please answer the question, is voice recording for alternate EVV vendors mandatory? Alternate EVV vendors must offer the option for clients to be able to verify by signature or by voice, so they must offer either signature or voice in their system. They must offer both, but there must be a choice for the client in how they verify. So they must have the ability to either use a signature or voice verification in one system. The next question is, can independent providers use the alt EVV system? At this time, no, agency providers are the only ones eligible to use an alt EVV system. Next question, after the May 6th cutoff date, will any alternate vendors be able to be certified? Yes, May 6th is the system system effective date for phase 2 changes. So it's not saying that that's a cutoff date for verification, but any phase 1 providers who are already using an alternate EVV system are encouraged to recertify for phase 2 by that date, so that you can send the phase 2 data elements that the system would be looking for at that time. You would still be able to send phase 1, but you want to be able to send phase 2 as quickly as possible surrounding that date. Just a friendly reminder, this webinar is being recorded and it will be posted to the ODM website in case you need to access it at a later time. The next question here is, when does the EVV system have to be in the homes to start the billing process? And for phase 1 providers, the requirement to use EVV began January 8th, 2018. For phase 2 providers, the mandatory use date will be August 5th, 2019. And billing will continue as it typically does at this time. And for reference, in case you need to see the services that are included under phase 1 and phase 2, you can find those on ODM's EVV initiative page website. The next question here is, our company has only been using Sandata and no other system. What I am taking from this is that we will no longer be allowed and must have another EVV provider. Is that correct? And I'm terribly sorry, that is not the message we meant to convey. I want to stem any panic from that. You do not have to use an alternate EVV vendor or alternate EVV system. That is an option that ODM provides to any agency providers, for instance, who might have already had their own EVV system in place. This is allowing them a way to certify and make sure that it is compliant with the EVV program so that they are still able to use that, and they are not forced to use the Sandata system. So if you are using Sandata and you are happy with that, you can continue doing so. The next one is a question that we've actually gotten a few times through the EVV provider hotline. Is it possible to use a combination of alternate EVV and standard EVV? And I'm guessing you probably mean Sandata EVV by standard. The answer to that is unfortunately no. There is one source of information that can be provided for each provider Medicaid ID to the Sandata aggregator. So it's either Sandata as the source through that portal or your alternate EVV system, but no combination of the two. Another question we have is, how can I print these documents? Not certain which documents you're referring to. I know we covered several on this webinar, but all of the documents mentioned on this webinar, as well as the PowerPoint for this webinar, you can find on ODM's EVV webpage. The PowerPoint for this webinar is not posted just yet. That'll be coming in the next couple of days. But all of the alternate system requirements documents that we talked about are already posted.
The next
The next question, if you are a direct care provider through the Ohio Department of Aging, does the Ohio Department of Aging have to do any of this training? And I do want to mention that ODM is working with the Ohio Department of Aging to provide phase 2 training. That phase 2 training is on the Sandata system. So if you are an agency provider who wants to use an alternate EVV system in phase 2, then this information would be helpful to you and you would not take that phase 2 training. So the key there is, are you an agency looking to use an alternate EVV system? If the answer is no, you'd want to look for your communication from the Ohio Department of Aging and ODM on your general phase 2 training. The next question, is our DoDD provider number the same as Medicaid ID number? And the answer to that is no, they are two separate identifiers. If you need any assistance in locating your Medicaid provider ID, please reach out to the Department of Developmental Disabilities and they'll be able to assist you with that. I have another question about where this webinar will be posted on the ODM EVV webpage. That would be under the training tab. That's generally where all recorded or live webinars that can be registered for will be posted. We have another question here regarding switching from using an alt EVV system to Sandata, or switching from Sandata to use an alt EVV system, and what the timing is around that. An agency provider can choose to switch from one system to the other at any time. There is no time limit on when you can move from Sandata to an alt EVV system, or from an alt EVV system to Sandata. You would just reach out to the EVV provider hotline to do that. If you start the alt EVV certification process and you no longer wish to use an alt EVV system, you want to use Sandata, same thing, you can reach out to the EVV provider hotline and just let them know you want to abandon the certification process. And that is no problem at all. They can walk you through the process for that. We have another question here of, will paper timesheets be needed? And unfortunately, I'm not familiar with which state agency you provide services for most often. I would recommend reaching out to that state agency and pose your question, just so they can get clarification, or you can have clarification provided on the exact process you're thinking through and what the policies are from that state agency on that. The next question here is, can you please clarify that the client verification is not required for DoDD providers? And it sounds like you're referring to the slide that talked about changes to the Sandata EVV system for phase 2, or rather, this is to the EVV program for phase 2. DoDD services are some of those services that are being added in phase 2. And due to the nature of how those services are typically provided, DoDD is not requiring that verification of time or verification of service provided be captured by clients at the time of service. So what this means is in the mobile visit verification device, a provider would not be prompted to hand the device over to the client and have them verify. Via telephony, they could just hang up when they get to the verification part of the process, and they would not see an exception for that.
The next question is, what are the options if clients cannot verify in any manner? I serve DD clients. As we noted, services provided through the DoDD waivers do not require verification. However, if those same individuals also receive state plan home health or private duty nursing services, program policy does require a verification at the time of service delivery for the state plan services. The EVV device will allow you to skip that verification and clear the exceptions. However, you may want to, at a minimum, work with your case manager to document why a verification will not routinely be collected at the time of service delivery for the state plan services only.
All right, the next question here, as an agency part of phase 2, I must reach eTRAC to be certified, and that's the question. This system is new to us, so should we be prepared to load clients and employees, or can we gradually add? I think if you're asking about using an alternate EVV system and not the Sandata system provided by ODM, I'm not familiar with what the setup process would be for that, but I imagine there would be a setup process of some type. You would just want to reach out to that alt EVV system to get clarification on that. For clarification on today's webinar, you do not have to load employees into eTRAC. There's no setup needed for eTRAC. You register in eTRAC so that you can communicate with the EVV provider hotline and work through alt EVV certification if you would like. And then you also register in eTRAC so that you could have ongoing support in phase 2 as a provider. If you do not intend to use an alternate EVV system in phase 2, I would recommend that you look for communication from ODM. You can also find it on their website regarding phase 2 training. The registration for phase 2 training for the Sandata system is now open. And you would take training and they would walk you through system setup at that time. There would be setup for the Sandata EVV system to use, but you will have a thorough training that walks you through what to do and how to do it.
I am currently an EVV Sandata user through an agency. Can I use the same EVV device as an independent provider? The devices are actually provided to individuals and can be used by all providers who provide, or all caregivers who are providing services to them. That being said, if as a provider, you also might choose to use the app on your own device, either a smartphone or a tablet.
The next question here, could you clarify again your response regarding clients verifying a visit with voice recognition? Is a system that offers only signatures sufficient? And what we had talked about earlier is that the EVV program requirements are that a client or an individual has the option to provide their verification either through signature or voice. In order to have a choice of how they verify, a system must offer both options. So both signature option and voice verification option.
Sure.
Next question, is it true that individuals billed on a day rate do not fall under EVV? And that is correct. Next question, our company has only been using Sandata and no other system. What I am taking from this is that we will no longer be allowed and we must have another EVV provider. Is that correct? I apologize for the confusion. No, that's not correct. You do not have to use an alternate EVV system. It is an option that is provided to agency providers. So this is a general informational webinar for any agency provider who might be interested in using that option, exercising that option. I have another question here. I think it pertains to phase 2 training, but please let us know through the chat if our understanding is incorrect. Will agencies receive a manual aside from the online manual as a quick reference? In regards to phase 2 training, you do receive a physical manual if you attend the classroom training. Webinar training or self-paced training, you would download the manual from the website to use as a companion for that. But classroom attendees do receive a physical manual to take home.
The next comment we have is I do not work for an agency, and we think that follows up regarding in response to ODA services. I think maybe to help clarify, if the service itself is subject to EVV requirements, the provider is required to use EVV, whether the provider is an agency provider or a non-agency provider. Only agency providers have the option of selecting an alternate EVV system. So the content in this webinar would not apply to you if you are a non-agency provider, but you should connect to the phase 2 EVV training and register for that so that you can receive the information you need and obtain access to the Sandata EVV system.
Okay, the next question we have here, can we use Sandata going forward if we are currently using an alt EVV? And the answer to that is yes. We would just ask that you reach out to the EVV provider hotline and let them know that you would like to switch back to Sandata. There is some setup and some behind the scenes work that would need to be done to make sure that you have a site ready to go. So it does take some coordination. So if you reach out to the EVV provider hotline and just let them know you're currently using an alt EVV, you want to switch to Sandata, and your intended date to do that, that would be very helpful.
The final question we have at this point is, I have an alternate EVV system that I am using for DD, but it is not completely ready for all aspects of my ODA services. Am I able to use Sandata for my ODA clients until August or until they have fixed the issue? So you cannot use both an alternate system and the Sandata system for the same dates of service, regardless of whether the services are provided through different payers or programs. That being said, EVV is not mandatory for the ODA nursing and aid services until August 5th, 2019. So there is not a requirement that you use EVV prior to that date. I would say that it's important that you work with your vendor to get to the point where you can use it for your aging services as soon as possible, so that you can take advantage of that learning period between May 6th and August 5th.
All right, if anybody has any lingering questions, this is last opportunity to type them into the chat box, and we will address those. I'll give just a moment or two for you to type those in and send them, if there are any, and then we will sign off. Okay, we do have a couple final questions here. When will the presentation be available to listen to again? ODM does need to work with its communications team, so it should be posted within the next week.
As an agency, will paper timesheets be needed for ODM? For ODM services specifically, the department has agreed to accept the time in, time out in lieu of documentation on paper. However, the remaining documentation requirements continue to exist. Things like progress notes, case notes, and tasks. So I would encourage you to review the ODM rules and make sure you are maintaining all the documentation required. In addition, that paper documentation may be helpful if you have to edit or manually enter a visit, because when you do that, you will need to attest that you have paper documentation to support the manual entries. If you aren't sure about the documentation requirements, you can send those questions to Home Health Policy at medicaid.ohio.gov.
And the final question we have here is, will the question and answer session be part of what's available later? And that's referring to the recording for this webinar posted to the ODM's website. And the answer is yes, the full recording will be posted, and it will include this Q&A session. All right, it appears that are all the questions that we've received today. Thank you for joining us on today's webinar. There are a couple upcoming webinars. If you enjoyed this one and would like to learn more about EVV reports, for instance, that webinar will be offered next Tuesday and Thursday. That's April 16th and 18th. And then there is another presentation of this alternate EVV informational webinar on Thursday, April 25th. Please go ahead and visit the ODM website, the training page, if you would like to register for those. Thank you so much. Have a great day.